What you must know about cervical cancer. Cervical cancer is a cancer that only affects women. You should be tested to ensure you don't have it. You will learn about some of these screening methods as well as what to expect. Learn about cervical cancer, how to help prevent it, and what the survival rate is if you do get it. What exactly is cervical cancer? The cervix is the uterus's lower part. The majority of cervical cancers start in the cells that line the cervix. Normal cervix cells gradually transform into precancerous cells. It takes time for precancerous cells to transform into cancerous cells, which is why regular screenings are so important. Cervical cancer screening. To screen for cervical cancer, 2 tests are performed, a Pap smear and an HPV test. The Pap test detects precancerous cells. The HPV test detects the human papillomavirus, which can cause cancer. The Pap test is advised for women aged 21 to 65. It is performed in the office of your doctor or gynecologist. A speculum, a metal or plastic instrument, is used to widen the vagina, and a few swabs are taken and tested in a lab to ensure they are not abnormal. The HPV test is performed in the same manner, but the lab will look for the human papillomavirus. The American College of Gynecology, ACOG, now recommends having a Pap smear every 3 years beginning at the age of 21. If you are at a higher risk, which means you have previously tested positive for precancerous cells, your doctor will recommend more frequent screenings. The Pap test is the most accurate cervical cancer screening test available. It does not detect other gynecological cancers, so if you experience any unusual symptoms, consult your doctor. Aside from regular screenings, you should make sure you're doing everything possible to avoid cervical cancer. Cervical cancer prevention. The most important thing you can do to prevent cervical cancer is to get screened. However, there are some other options available to you. Because HPV can cause cervical cancer, getting the HPV vaccine will help you avoid getting it. Aside from that, eating healthy, not smoking, having fewer sexual partners, and practicing safe sex, using condoms, will help you avoid cervical cancer. The human papillomavirus, HPV, is a sexually transmitted disease. While HPV can live on both male and female genitalia in areas unprotected by a condom, using a condom has been shown to reduce the chances of transmitting HPV and developing cervical cancer. All of these precautions will help you avoid cervical cancer. Developing cervical cancer. Precancerous cells typically take a few years to transform into cancer cells, and this does not always occur. This is why it's critical to have regular screenings to catch cancer early, because early detection is always your best bet. Many factors will influence your chances of survival if you have cervical cancer. These include cancer type, cancer stage, age and general health. If the cancer returns after treatment. The greater the spread of the cancer outside of the cervix, the lower the chances of survival. So, once again, screening is critical to catching it early. It is entirely reasonable to expect that you will live for at least 5 years after being diagnosed with cervical cancer.